Hi, I'm Dr. Paul Miller. I'm Director of Sports Medicine for Aurora Advanced Healthcare, a hospital and physician group in southeastern Wisconsin. Today I want to talk to patients about graft selection and ACL reconstruction. The knee, like all joints, is held together by ligaments. In the knee there are four main ligaments, two which are on the sides of the knee, which are called the collateral ligaments, which give side-to-side stability, and two which crisscross through the middle of the knee, which are called the cruciate ligaments. That's Latin for cross, and they give front to back and rotational stability. The front cruciate ligament is called the anterior cruciate ligament. That's a ligament that's commonly injured in sporting injuries. And generally the treatment for the anterior cruciate ligament injury is surgical repair. When we repair the anterior cruciate ligament, we have to put something in place of that ligament. That's something we call a graft. And the graft has to be human tissue. There are two main choices for putting a graft in place. You can use your own tissue, and that is called an autograft. Or you can use tissue that's been donated to the tissue bank from a tissue donor, and that's called allograft. There are pros and cons to autograft and allograft reconstructions, and we're going to go into each of these in more detail. The two most common choices for using the autograft reconstruction or your own tissue are the patellar tendon and the hamstring tendons. The patellar tendon is the tendon between the patella or kneecap and the lower leg bone or tibia. And the patellar tendon graft takes a strip of that tendon, usually the middle 1/3, with a piece of bone off of each end. And this gives us a graft that has a piece of bone at each end. The hamstring tendon is a tendon which is on the inner part of the knee, and actually it's a complex of several tendons, and for ACL reconstruction usually one or two of the hamstrings, generally the semitendinosus and the gracilis tendons, are harvested. In an ACL reconstruction where we use a patellar tendon autograft, we take a strip of tissue from the patellar tendon with a piece of bone block at each end, and we end up with a piece of tissue that looks something like this. Now the advantage of this procedure is that we can get a piece of bone at each end, and so when we pass that through bone tunnels and fix it down with a screw that's usually an absorbable or a bioabsorbable screw, we get good solid fixation, bone against bone at either end. That enables us to be more aggressive with our rehab program, and generally patients are able to return to full sports at an earlier time frame than they would with the other repairs. So in general, many surgeons feel that the patellar tendon reconstruction allows them to be the most aggressive in terms of their rehab. That's the major advantage of the patellar tendon reconstruction. The disadvantage of the patellar tendon reconstruction is that we're working on the front of the knee, and some patients can get some soreness in the front of the knee, and patients who do a lot of kneeling, that may be a concern for them. Also, in some patients there is a risk that they may get some cartilage wear underneath the kneecap, although the incidence of that has not been shown to be any higher than with an allograft reconstruction in research studies. With the hamstring ACL reconstruction, the hamstring tendons are harvested in one of two fashions, either with an incision along the hamstring insertion along the tibia, or with an incision around the back of the knee, and the hamstrings are harvested with a tendon harvesting instrument. The incisions for the hamstring harvest are a little bit smaller and a little bit more cosmetic than the patellar tendon incision. That's one advantage for the hamstrings. Also, another advantage for the hamstring graft is that it eliminates some of the possibility of anterior knee pain or front of the knee pain. On the other hand, with the hamstring tendons, there is some chronic hamstring weakness. This is one of the types of donor site morbidity that we describe with any type of graft reconstruction. The other advantage with both the patellar tendon and hamstring tendon autografts are that they're your own tissue. So there's not a concern over disease transmission or infection like there would be with an allograft reconstruction. When we do the hamstring autograft reconstruction, we get a piece of tissue that we are able to trim and then fold over into a graft, which we then stitch at each end. And then this graft we're able to insert through bone tunnels into the knee, and that's our reconstruction. But since there are not bone blocks, we have to fix the graft with loops or some type of stapling device on each end of the bone. This makes the graft a little bit more pliable, and there's a little bit more risk for graft stretch out. Also, because the fixation is not as robust, the rehab is in some cases longer according to surgeon preference. Because the graft is all soft tissue in the bone, some surgeons will hold their hamstring reconstruction patients out for longer before they return to full sport as compared to some of the other graft techniques. When we do an ACL reconstruction using allograft tissue, which is tissue bank tissue, there are pros and cons. Some of the disadvantages of using the allograft tissue are that it comes with an expense that we don't have with using autograft tissue. Also, because that tissue is not your own, it has to undergo a sterilization process. That can weaken the graft. And there are studies which suggest that the failure rate for allograft reconstruction is significantly higher, especially in patients under the age of 40. Additionally, the allograft tissue reincorporates and revascularizes at a slower rate than autograft tissue. This means that some surgeons will hold back their allograft reconstruction patients for a longer period of time before return to full sport. The advantages of an allograft reconstruction are that there's no donor site morbidity. That means that you don't really have the risks for front of the knee pain like you would for a patellar tendon autograft, or for the hamstring chronic weakness like you might have for the hamstring autograft. One of the other advantages of an allograft reconstruction is certain specific situations where a patient might need a redo or revision reconstruction where they have their previous tissues already used up, or in a patient who has a multiple ligament injury to the knee where several grafts are needed and there's not enough of your own tissue to go around. So there are uses of an allograft that are certainly quite appropriate in special circumstances. Whether you and your surgeon choose to use an autograft or allograft tissue, and whether if it's an autograft, whether you choose to have a patellar tendon or hamstring tendon or some other variation, is only part of the process. Far more important is the surgical technique and the skill of the surgeon and appropriate placement of the graft. An appropriate placed graft is the most important factor in a successful reconstruction. Well, thanks for listening. I hope it was as helpful and you learned something, and I wish you the best of luck in your medical care.